Kidneys are two reddish-brown bean-shaped organs found in vertebrates. They are located on the left and right in the retroperitoneal space. And in adult humans they are about 4 inches in length. Blood is received from the paired renal arteries and exits into the paired renal veins. Each kidney is attached to a ureter, a tube that carries excreted urine to the bladder.
The kidney participates in the control of the volume of various body fluids, fluid osmolality, acid-base balance, various electrolyte concentrations, and removal of toxins. The nephron is the structural and functional unit of the kidney. Each adult human kidney contains around 1 million nephrons. Kidneys are essential to having a healthy body. They are mainly responsible for filtering waste products, excess water, and other impurities out of the blood. These toxins are stored in the bladder and then removed during urination.
The kidneys also regulate pH, salt, and potassium levels in the body. They synthesize the hormones renin and erythropoietin that regulate blood pressure and control the production of red blood cells. They even activate a form of vitamin D into calcitriol that helps the body.
Kidney diseases affects approximately 37 million American adults. It occurs when the kidneys become damaged and cannot perform their function. Damage may be caused by diabetes, high blood pressure, and various other long-term conditions.
Kidney stones are one of the most common kidney problems. They occur when minerals and other substances in the blood crystallize in the kidneys, forming solid masses. Kidney stones usually come out of the body during urination. Passing kidney stones can be extremely painful.
They typically form in the kidney and leave the body in the urine stream. A small stone may pass without causing symptoms. If a stone grows to more than 5 millimeters, it can cause blockage of the ureter, resulting in sharp and severe pain in the lower back or abdomen. Stones form in the kidney when minerals in urine are at high concentrations. Most stones form by a combination of genetics and environmental factors. Risk factors include not drinking enough fluids, hyperparathyroidism, gout, high urine calcium levels, obesity, and some medications like calcium supplements. Stones are typically classified by their location into nephrolithiasis, in the kidney, ureterolithiasis, in the ureter, and cystolithiasis, in the bladder, or by what they are made of, like calcium oxalate, uric acid, struvite, or cysteine.
Glomerulonephritis is an inflammation of the glomeruli. Glomeruli are extremely small structures inside the kidneys that filter the blood. Glomerulonephritis can be caused by infections, drugs, or disorders that occur during or shortly after birth. It is not strictly a single disease, its presentation depends on the specific disease entity, as it may present with isolated hematuria or proteinuria, or as a nephrotic syndrome, a nephritic syndrome, acute kidney injury, or chronic kidney disease.
Nephrotic syndrome is a collection of symptoms due to kidney damage. This includes protein in the urine, low blood albumin levels, high blood lipids, and significant swelling. Other symptoms may include weight gain, feeling tired, and foamy urine. Complications may include blood clots, infections, and high blood pressure. Nephrotic syndrome is usually caused by damage to the clusters of small blood vessels in your kidneys that filter waste and excess water from your blood. What differs glomerulonephritis from nephrotic syndrome is the degree of proteinuria. In nephrotic syndrome, there is a massive proteinuria with the protein loss usually over 3.5 grams per day, but in glomerulonephritis, there is only a mild proteinuria where the daily protein loss is less than 3.5 grams.
The nephritic syndrome is characterized by blood in the urine and a decrease in the amount of urine in the presence of hypertension. In this syndrome, inflammatory damage to cells lining the glomerulus are thought to result in destruction of the epithelial barrier, leading to blood being found in the urine. At the same time, reactive changes, such as proliferation of mesangial cells or macrophages, which may result in a decrease in kidney blood flow, result in a decrease in the production of urine. Then the renin-angiotensin system may be subsequently activated because of the decrease in perfusion of juxtaglomerular apparatus, a group of cells that produce renin, which may result in hypertension. Polycystic kidney disease is a genetic disorder that causes numerous cysts, small sacs of fluid, to grow in the kidneys. These cysts can interfere with kidney function and cause kidney failure. It is a genetic disorder in which the renal tubules become structurally abnormal, resulting in the development and growth of multiple cysts within the kidney. These cysts may begin to develop in utero, in infancy, in childhood, or in adulthood. Cysts are non-functioning tubules filled with fluid pumped into them, which range in size from microscopic to enormous. It's important to note that individual kidney cysts are fairly common and almost always harmless. Polycystic kidney disease is a separate, more serious condition that requires medical intervention.
Urinary tract infections are bacterial infections of any part of the urinary system. Infections in the bladder and urethra are the most common. They are easily treatable and rarely lead to more health problems. However, if left untreated, these infections can spread to the kidneys and cause kidney failure. The most common cause of infection is Escherichia coli, though other bacteria or fungi may sometimes be the cause. Risk factors include female anatomy, sexual intercourse, diabetes, obesity, and family history. Although sexual intercourse is a risk factor, UTIs are not classified as sexually transmitted infections. In uncomplicated cases, UTIs are treated with a short course of antibiotics such as nitrofurantoin or trimethoprim or sulfamethoxazole. Resistance to many of the antibiotics used to treat this condition is increasing. In complicated cases, a longer course or intravenous antibiotics may be needed.
Nephritis is generally the inflammation of the kidney. Glomerulonephritis is characterized by inflammation in the glomeruli of the kidney. In this case, the glomeruli are completely filled in blood. The symptoms and signs of nephritis, or Bright's disease, were first described in 1827 by the English physician Richard Bright, after whom the disease was named. In his reports of medical cases, he described 25 cases of edema which he attributed to kidney disease. Many of these cases were found to have albumin in their urine, which was detected by the spoon and candle heat coagulation test, and showed striking morbid changes of the kidneys of autopsy. The triad of dropsy, albumin in the urine, and kidney disease.
The most common form of kidney disease is chronic kidney disease. Chronic kidney disease is a long-term condition, an irreversible destruction of the kidneys that does not improve over time. And it's commonly caused by high blood pressure. High blood pressure is dangerous for the kidneys because it can increase the pressure on the glomeruli. Glomeruli are the tiny blood vessels in the kidneys where blood is cleaned. Over time, the increased pressure damages these vessels, and kidney function begins to decline. High blood pressure can also damage the blood vessels of the heart and brain. The kidneys are highly vascularized, meaning they contain lots of blood vessels. So, blood vessel diseases are generally dangerous to your kidneys. Autoimmune diseases such as lupus can damage blood vessels and can make antibodies against kidney tissue. There are various other causes of chronic kidney disease, such as polycystic kidney disease, which is a hereditary cause. Kidney function will eventually deteriorate to the point where the kidneys can no longer perform their job properly. In this case, a person would need to go on dialysis. Dialysis filters extra fluid and waste out of the blood. It can help treat kidney disease, but it cannot cure it. There are two types of dialysis: hemodialysis and peritoneal dialysis. Hemodialysis is usually done 3 times per week, for about 3 to 4 hours for each treatment, during which the patient's blood is drawn out through a tube, at a rate of 200 to 400 milliliters per minute. The tube is connected to a needle, which in turn is connected to one port of a dialysis catheter. The blood is then pumped through the dialyzer, and the processed blood is pumped back into the patient's bloodstream through another tube. On the other hand, in peritoneal dialysis, the abdomen is cleaned in preparation for surgery and a catheter is surgically inserted with one end in the abdomen and the other protruding from the skin. Then 2 to 3 liters of dialysis fluid is introduced into the abdomen over the next 10 to 15 minutes. The fluid is then removed and replaced with fresh fluid to absorb toxins from blood. This can occur automatically while the patient is sleeping, or during the day by keeping 2 liters of fluid in the abdomen at all times, exchanging the fluids 4 to 6 times per day.
The term lupus has been used to identify a number of immune diseases that have similar clinical presentations and laboratory features. But systemic lupus erythematosus is the most common type of lupus. The exact cause of systemic lupus isn't known, but several factors have been associated with the disease. The disease isn't linked to a certain gene, but people with lupus often have family members with other autoimmune conditions. Environmental factors can trigger the disease, which may include ultraviolet rays, certain medications, viruses, physical or emotional stress, and trauma. No cure for systemic lupus exists. The goal of treatment is to ease symptoms. Treatment can vary depending on how severe the symptoms are.
Acute kidney injury, previously called acute renal failure, is a sudden decrease in kidney function that develops within 7 days, as shown by an increase in serum creatinine or a decrease in urine output, or both. Causes of acute kidney injury are classified as either prerenal, due to decreased blood flow to the kidney, intrinsic renal, due to damage to the kidney itself, or postrenal, due to blockage of urine flow. Prerenal causes of acute kidney injury include sepsis, dehydration, excessive blood loss, cardiogenic shock, heart failure, cirrhosis, and certain medications like ACE inhibitors or NSAIDs. While intrinsic renal causes include glomerulonephritis, lupus nephritis, acute tubular necrosis, certain antibiotics, and chemotherapeutic agents.
Depending on the cause, some types of kidney disease can be treated. Often, though, chronic kidney disease has no cure. Treatment usually consists of measures to help control signs and symptoms, reduce complications, and slow progression of the disease. Kidney disease complications can be controlled to make the patient more comfortable. As people with chronic kidney disease often retain fluids, this can lead to swelling in the legs as well as high blood pressure. Medications, supplements of the hormone erythropoietin, sometimes with added iron, help produce more red blood cells. This might relieve fatigue and weakness associated with anemia. If the kidneys can't keep up with waste and fluid clearance on their own and the patient developed complete or near complete kidney failure, it is called end-stage kidney disease. At that point, a dialysis after a transplant, the patient will need to take medications for the lifetime.